the benefits of being on hormone therapy for women.
So if we look at the benefits, so we will say, well, I think the breast cancer debate is, will go on, but I think right now the best evidence we have is that it does not increase the risk of breast cancer, and done appropriately with the right types of hormones, bioidentical estrogens and progesterone, that the risk is, if anything, reduced. Now, what about the other benefits? We absolutely know that one of the few things that is going to be beneficial to preventing dementia is hormones. I mean, estradiol and progesterone are really important for the brain in both men and women.
Mm-hmm.
It's super important for the brain. And we don't have a lot right now to say, we're getting more knowledgeable in this realm, but right now there is not a drug out there that is going to reverse your dementia. I mean, the best they've done with some of the drugs, and that's debatable, is reduced the rate of decline, but not reverse it. So we really have got to protect our brains. Absolutely have to. None of us want to be demented.
Welcome to Old God Talks to Me, a podcast dedicated to helping guys create kick-ass lives for themselves and those that they love. Ladies, if you want to know what your guy is thinking, this podcast is for women too. Each week, a special guest helps you create that life you've imagined. We talk anti-aging medicine, personal growth, relationships and hot sex. Yeah, you hear me, getting laid more frequently, other guy vices, and topics that many don't want to talk about but need to. Just because you're getting older doesn't mean you have to be old. Don't want to miss anything? Be sure to subscribe, share, rate, and review this podcast. And be sure to go to www.thestandard.academy/magazine and grab a free copy of our new digital magazine, The Standard Academy, where we talk about erogenous zones, growing hair back, and other things that will help you create that kick-ass life. Now get ready to listen up and share with friends.
So your health declines once you have a fracture.
I've heard that before, and it's an amazing statistic. I think that fractured hip is not unusual.
Not at all, right? You hear it all the time. It's just people. It is so common. If you fall and break a hip, it's because you're osteoporotic. I mean, maybe you fell off your mountain bike and fell off a cliff, but if you slip on the ice and break your hip, you are probably osteoporotic.
Yeah.
And that's because you didn't do the things to protect your bones. Hormones being a big player there.
Yeah. In January of 2022, I was at that point I was 69. I had some diverticulitis, which required me to have an ostomy. And for those of you that don't know what ostomy is basically they cut your colon and your intestine apart, and you shit through a bag in your stomach. And one of the things that I was really worried about is that you have these life-changing things, broken hip or whatever. And one of the things I was very, very worried about, very conscious about, was not becoming decrepit.
Yeah,
because you see this all the time, and I don't know, I don't notice it that much in women, but in men, you see a guy in the gym, he's older, he's vibrant, and next thing you see him a few months later, and he's decrepit. And that was one of my major concerns, was becoming decrepit. And for me, I firmly believe this. I've talked to a friend of mine, Scott Howell, who's an androgen expert. He's actually, I think you enjoy talking to him. And he actually helped write the USA Powerlifting Association position paper on trans athletes, which you can imagine what that was all about.
Yeah.
But he said that there's actually some very significant healing benefits to being on testosterone optimization. I'm thoroughly convinced. I don't have any scientific data other than my anecdotal information, my personal experience. But I am thoroughly convinced that I got through this, and I'm back to where I was, in the gym, I'm doing things and all of that. And I thoroughly believe that a large part of that is that my testosterone optimization, which not just helps me physically, but for me, it's a monster attitude adjuster.
Yeah, and don't forget that's true of women too, right? So we forget
Yeah, exactly.
that, that the exact same things that happen for you with testosterone happen for women. So even those doctors who are giving their women estrogen replacement, I always see them not getting testosterone. It's very funny. So again, you talk about healing and recovery. I will actually use anabolic hormones a lot to help my people heal and recover more rapidly. Whether you have a rotator cuff injury or fracture or whatever it might be, or have to have a surgery, using anabolic hormones is really beneficial. In fact, there's some great studies about nandrolone. Nandrolone, which is very, very anabolic compared to testosterone. If you look at testosterone, it's like 1-to-1 androgenic, meaning everything else you think about guys, anabolic being muscle, bone building. Nandrolone's 15-to-1 anabolic. So back, many, many years ago, the main thing we used nandrolone for was to help osteoporosis in little old people. And then it was all found, wow, people like men healed faster with nandrolone on board. And then it got picked up by the bodybuilder crowd. And it was funny. I was just lecturing at the Mr. Olympia a few months ago. And, so these things fell into the bodybuilder crowd and the doctors stopped using them when, really the bodybuilder crowd actually just knew how to optimize a little bit, but the drug is still great for healing. And yet it fell out of the medical world simply because it kind of fell into this sort of steroid abuse world. And it is still a wonderful hormone to use in both women and men to help them heal and recover. So you can put them on like a 12-week course of nandrolone to really help them to heal. And to really build bone. So like I have a little old lady who had a non-healing vertebral fracture, osteoporotic fracture. Of course, again, nobody even looks at these women. They're like, getting more and more stooped over, and they have osteoporosis, and nobody's treating them. And then of course she finally fractures 2 vertebrae. They won't heal. Nothing's helping. She's in miserable pain, just horrible. And they actually tried we can actually inject cement into the vertebrae, and when you do that, you stress the vertebrae above it, and she fractured the next vertebrae. So she came to me, and we put her on literally a 12-week course of nandrolone. And within 12 weeks, her fractures were healed. She was out of pain. It was, dramatic. So you could do a lot with some of these anabolic hormones in both women and men to help heal. But that's where testosterone gets so ignored in women in recovery too, but also for protection of bone, for protection of muscle. You have to have muscle as you age as well. Estrogen gets all the play for women for bone, but testosterone is more anabolic for bone than estrogen is. Estrogen maintains bone. Testosterone makes you rebuild bone. So, if women have already lost bone, you need to put some, a fair amount of testosterone on board. So, I agree with you. I think we forget that these hormones are so valuable to healing. And you're right. You have an injury or, you get sick and you're older, your likelihood of ever coming back to where you were is much, much lower. But if you give people back what they need, they will, in both women and men. So, so it's such a great point because it's funny. I have a great little 74-year-old who works at my front desk, and she's great. And she started working for us. She was a retired principal. She started working for us. My adage is, if you ever retire, retirement is you're just basically saying, I'm going to die. She was saying, she said, yeah, if I'm ever in a retirement home, I better be working there. So the key is that we actually did this team building event where we went to one of those break rooms, where you actually take a sledgehammer and you break everything, which, unfortunately she did have osteoporosis. She slipped over one of the things on the floor and broke her hip. And I was with her through the whole way, because I then took her to the ER and we had to have surgery. And the doctor tells her, and this is vital. I mean, she's in a break room, throwing a sledgehammer. That's how she even breaks her hip, right? But he looks like, just anticipating she's the usual little old 74-year-old, and goes, he goes, yeah, he goes, it's going to be a long recovery. You'll probably never get back to walking the way you were, but you'll be able to walk with a cane. And I'm like going, oh my God, who says this to somebody and sets them up for that kind of thing? So he left the room. I go, don't worry, Ellen, you will be fine. You will not be walking with a cane, and we put all stops on her, right? We stuck high levels of hormones into her, we put peptides into her, and 3 months later she's doing great. So I think we forget so much that these hormones and all the things we're doing that helped us to recover when we were young, we'll do the same thing when we're old.
Yeah.
So off track there a little bit, but
No. I think that was interesting. Yeah, because the reality of it is that what we're talking about is optimization,
right.
Using cutting edge medical therapies. And the reality of it is that I would say 80% of physicians don't have a clue. I mean, is that too high of a number, or is it too low of a number? But
No,
they really don't have a clue.
Yeah, I mean, I don't know what that number is. I get more and more disillusioned at what I hear. I was in an orthopedic practice for 30 years doing both practices, but I finally left my orthopedic clinic because literally when I was trying to treat people with hormones and optimization therapies, one of my partners came to me and they said, listen, we don't do medicine here. We do orthopedics. So don't be using these hormones and things like that. You can't be doing that here. So completely neglecting that that's a part of actually orthopedics, right? Finally, I'm like, okay, well, obviously we're not aligned. So I get more and more disillusioned about the medical field. I hope that it's changing a little bit. I think 80% is probably a little conservative but I think it is growing, that more doctors are getting a little bit of awareness.
Yeah.
And yeah, the number one thing when I put people on hormones, they go back to the primary care doctor who goes, well, you don't need these. I mean, you're 60 years old. When are you going to stop them? And so they'll come back to me. Well, my doctor said, well, when will I stop these? I go, I don't know. When you want to die? It's like,
how's the quality of your life? It was very interesting when I was a periodontist. Literally within periodontics, when I was in my residency, I actually had my residency at the University of Spoiled Children, also at the dental school. Was basically you take a knife, a scalpel, and you cut away the diseased tissue and you sew people up, and you give them very hypersensitive, ugly teeth. That was the end result, and boy, everybody just wanted to sign up for that. But what happened was that somehow we got into a very regenerative phase of therapy, and we started learning how to build back bone around teeth. We started learning how to build back connective tissue around teeth and all of that. And so periodontics, I mean, literally within 5 years, everything that I learned in my residency program was obsolete. I was hardly doing anything that I learned in my residency program. And we became very regenerative oriented, using lots of things. I think I mentioned to you a while back. I mean, I started using PRP for surgeries in 2000.
Right, you were one of the early adopters of that, yeah.
Yeah, and there's all sorts of other regenerative materials that are available now, and I haven't really kept track since I've been out of practice now for several years, so I'm not really focusing on that. But I think if physicians or any kind of healthcare practitioner doesn't keep up, and they're not doing they're doing a disservice to their patients.
You're right. Mm-hmm.
Because there are so many regenerative procedures now. I mean, we're all going to die. Okay, we can lay that out. We can all die, but it's not the difference is, what's your journey going to be to that day? Are you going to be happy? Are you going to have
right, miserable and decrepit, and and sitting in your wheelchair and a little, and drooling on somebody feeding you, right? Which is what none of us want. But I'm going to comment on even your periodontist story, because it's progressive then, as you sort of, how many periodontists look at hormones, and yet critical, right? I mean, you need bone, you look at jaw necrosis, things like that. That's all part of, hormonal aging too. And I don't know one and I know some very
Probably.
progressive periodontist who's actually encouraging hormone use, in their patients. I mean, are you seeing that in that field? And it's like,
I have not, but to be real honest, when I left, it was a very clean break into my next phase of my life.
right. So it wasn't like you didn't dabble in, yeah.
No. I was done. And I was done for a number of reasons. One is that I realized I was no longer interested in being the best version of myself as a periodontist. And that was the time to quit. That was really the time to quit because I was always been kind of a cutting edge person. I still continue to be a cutting edge person,
right? But in different fields,
in different fields. But that was a time for me to leave my practice because I was still very good at what I did, but I just really did not have the passion, and I was not interested in going to another continuing ed class or giving a continuing ed class. I was done.
Right.
I was done. So we talked about this a little bit briefly. I want to get back on the women's hormone thing, but I'd kind of like to maybe if you can enumerate again for our audience the benefits of being on hormone therapy and for women.
So if we look at the benefits, so we will say, well, I think the breast cancer debate is, will go on, but I think right now the best evidence we have is that it does not increase the risk of breast cancer, and done appropriately with the right types of hormones, bioidentical estrogens and progesterone, that the risk is, if anything, reduced. Now, what about the other benefits? We absolutely know that one of the few things that is going to be beneficial to preventing dementia is hormones. I mean, estradiol and progesterone are really important for the brain in both men and women.
Mm-hmm.
It's super important for the brain. And we don't have a lot right now to say, I mean, we're getting more knowledgeable in this realm, but right now there is not a drug out there that is going to reverse your dementia. I mean, the best they've done with some of the drugs, and that's debatable, is reduced the rate of decline, but not reverse it. So we really have got to protect our brains. Absolutely have to. None of us want to be demented. And hormones is really one of the few ways that you can do that. So number 2 is cardiovascular risk. So cardiovascular disease is still the number 1 killer, way above breast cancer. And yet we sort of forget about it in women, right? And so estrogen, especially started early. So the studies have shown that it has its most benefits. So clearly when it started later, it may not have the same benefits as a cardiovascular protectant, but started early. So started when hormones start to decline, it appears to have significant benefits in protecting the heart. There's a researcher out of Stanford who's doing a lot of that research with that. So really early intervention, not waiting until you're 70, but when hormones start to decline, replacing them. So, we're trying to encourage people to know what their hormones are and follow them and know when they start to decline, because that's going to be really the key to starting to use interventions. And sometimes you can use things that just make your own hormones, make yourself make more hormones. Other times you have to use the hormones themselves. So cardiovascular risk, number 1 cause of death. We can reduce that risk considerably. Then you look at, again, we just talked about fractures. There's absolutely nothing more important than all 3 of these hormones: estrogen, progesterone, and testosterone in bone protection.
Do you need accountability? Are you looking to change the course of your life but have failed to keep on track? Too often we take in information and fail to act. Do you need an accountability program to stay the course? Then go to www.thestandard.academy and find out about my accountability program that goes with my course that helps you find out what you want, why you want it, and how to get it. The accountability program keeps you on track to get results.
And again, when you look at the data on what happens after a fracture, it's astounding. And it's completely ignored. Women fall, break their wrist. Nobody looked to see if it was a bone density issue. you guys see them, these little old people all hunched over. Those people are having compression fractures in their vertebrae. It might be mild. They might not even feel them. When you get x-rays, when I get x-rays of their spine, each one of their vertebrae is collapsed down in this sort of triangular, what we call fish mouth fashion. These women are suffering constant fractures. That's horrible, right? So we've got now cardiovascular risk, and now we've taken really the top 3 things that are going to help you make you age poorly: dementia, heart disease, and bone loss. Let's take the last one. We absolutely now know that maintaining muscle mass is really important. We call muscle the currency of life, because honestly, once you lose muscle, once you become sarcopenic, everything else starts to go. Your muscles are what make you be able to stand up out of your chair and walk. If I do not have muscle strength, my joints are going to be hurt. I'm not going to be able to do the things I need to do. I'm not going to be able to function. It is impossible to maintain muscle without hormones. Impossible. I don't care how much you go to the gym and work out. You can go to the gym every single day of your life and lift weights or try, and you will not maintain muscle. So now we've taken the 4 things that really decline with age that none of us want to be. We don't want to be sitting in our chair, not being able to move, in pain. We don't want to have fractured our vertebrae and can't really even stand up anymore. We don't want to have cardiovascular risk, and we don't want to have dementia. And we have a simple solution, that is start hormones, stay on hormones, and keep them optimal throughout life.
There's a thing I heard a long time ago, something called Wolff's Law, that says a bone under stress from lifting exercises increases in density. And
right.
And so that's, I think the combination using some sort of resistance training is
right. You have to do resistance training. Obviously, the hormones, cells aren't going to do it unless you're doing the resistance training too. You have to load the muscle and bone, but bones or muscles also are very important to the bones, not just for support, but because our muscles produce hormones. We forget that muscles are endocrine organs, just like your liver or your testicles or your ovaries, and they are producing hormones as well, and things like we call myokines. And myokines are actually really important for maintaining bone. So the muscle releases things when I exercise that tell my bone, that stimulate my bone production. So it's actually even a chemical influence that's from the muscles. And so when I have muscles, when I go exercise my muscles, I'm actually supporting my bones just from that. So it's not just the load to the bones, it's actually the force on the muscle or the chemical influences of the muscle affecting the bones too. So, we'll take all those things and we'll just take quality of life. I mean, again, if you look at, libido, right, in women, which declines, and in libido in women is tricky, and men libido is easy, and women libido is hard. It's a very difficult thing.
What's the joke? How often does a guy think about sex? And like, it was every 5 seconds.
Yeah, there's some interesting research on women, because you can get women's hormones all really optimal. You can get their testosterone levels nice and high, and they still have poor libido. And there's some interesting data that the brain, once women are not wanting to have kids anymore, there's really just parts of the brain that change. And that may be one of the tricky things with women, is that we're sort of designed for childbearing. That was kind of our goal. Men, not so much. Your design is to, just get out there as much as you can. But in women, it's to, we can only carry a child for certain amounts of time. And so once that the brain is no longer wanting to have a kid, there's some very interesting data that support that that's probably one of the reductions in libido. And so how do we change and stimulate those parts of the brain? We'll probably have to work a little bit more in terms of that. You can do things like oxytocin, things like that can be helpful there. But women are tricky in that realm.
Well, in my coaching program, one of the modules is how to get laid more frequently without begging.
Yeah. Yeah, I think I saw one of your podcasts with that.
Yeah. And so we talk about that, because I think as much as there's some scientific stuff, there also is some behavioral things that guys do that influence the level of intimacy in their life in a bad way.
Yeah.
And and I don't think I don't think they actually even know that they're doing it. I just more draw attention to things that, like, okay, if you do these things, you're going to have a better relationship with your significant other, because it's not just about sex. Actually,
Right.
It's really more about spiritual, emotional, and physical intimacy. And that's what I would say, that's what a lot of people want, even though they say, like, I want more sex.
Yeah, you're right.
So,
but
Betsy,
but
sorry,
again, that does become the hormones are still going to be important there, right? So vaginal dryness, things like that, right? Women don't want to have sex because it hurts, because they have vaginal dryness, and so estrogen and hormones are going to help that. It is also just honestly the mood differences. If, like I said, perimenopause becomes a hard stage for anybody to live with people. And, and it's because you become more irritable. You snap at people more. You're just not a nice person. So honestly, very interesting once you balance those hormones out, you'll see, couples just get along better, because there's not this, these mood shifts, and, and people are just a little more level.
Gosh, it's taking me back to when I was in the 8th grade, and my mother had a horrible experience with menopause. I mean, it was horrible. And the fighting that occurred in my house, it was so bad that the last semester in the 8th grade, I got shipped off by the nuns at my school to live with an aunt and uncle in Ohio.
Really?
To let my parents get their shit together.
Yeah.
It was incredible. And for some people it can be, I mean, it was a horrible experience. So you mentioned this, and I'm kind of want to close here on this. So you have a woman who comes in, and she's concerned about getting on hormone therapy. What do you say to reassure her about it?
Well, I actually honestly show her the studies. So we have this learning academy. It's called Human Optimization Academy. So we actually have a lot of literature on that. If you guys go, it's just bli.academy. You can register, become one of our academy members. We do very fun Q&As every month. We have content out on that, but it's also just some free data from some free lectures on there. So I actually run through lectures that have, because I think you have to base things a little bit on scientific data, right? I can tell people all I want. Hormones don't cause cancer. I promise they don't cause cancer. But if I show them the studies, I flip through the studies, and here's a study from American Family Physician 2021, 20-year follow-up of the Women's Health Initiative showing lower breast cancer mortality with estrogen, published in 2021, 20-year follow-up, right? You look at all-cause mortality, reduced study on all-cause mortality, 35% reduction in all-cause mortality on hormones. So I actually flipped through these slides with them, right? 10-year follow-up is this study called a habit study that followed hormone replacement therapy and supported that these women had reduction risk in all of these different diseases. So I show them the studies, and then I actually arm them with the studies. I go, okay, here. And I said, so when you go back to your doctor and they tell you hormones have cancer, give them these studies and ask their opinion. Because I think as physicians, we don't do enough of that, right? In fact, doctors, and here's the big thing I get from doctors: they go, I don't need to read the studies. I literally arm my patients with like a stack this thick of things. I go, here, go back and see what they say. And I'll be the first, if my patients bring me data, I love it, and I'll review the article, and some of the articles are well written and good, and I'll say, okay, let's talk this through. But I think you have to arm people with scientific evidence, and so that's one of the ways. Like in our Human Optimization Academy, what I do is I actually teach through scientific data, as opposed to just my opinions or people's opinions, or this is what we think. So once you've shown them the scientific data, they have, they can form their own opinions. I'm never going to convince you one way or the other, but you can now take this data and form your own opinions. And most people are like, oh, that looks really good, I want the hormones. But if they don't, they don't. That's their choice. They can, choose.
Sure. Yeah, I have a whole Dropbox file with articles on testosterone, on peptides, on exosomes, on PRP, all sorts of stuff. And so I go like, okay, these are the facts.
Yeah, right. Here's the data. Take it with what you want, right?
Yeah. So, and if somebody wanted to work with you, how do they find you? And I'll put it in the show notes.
So best thing to do is just go to our website. So boulderlongevity.com. There's a little section there where you can just fill in and say, I'm interested, please give me a call. So you can fill that in. And one of our client reach out people will call you, say, explain things more, answer your questions, and you can set up an appointment with myself or my PA, Emily. We do a lot of orthopedics too. So we do a lot with regenerative orthopedics as well here, using sometimes hormones and peptides to help treat the orthopedic injuries as well. But so if you just go to bli.academy, fill out the questionnaire, a little form in there, then somebody will get back to you. That's the easiest thing to do. And like I said, spend time educating yourselves on this, guys, because your physicians, as Orest said, your physician doesn't know a lot of this, and you're going to have to educate them. So the more you can educate yourself. So go to join our academy. We're trying to spread this so that people become more their own pilot. It's what you do. You're doing right. People need to take charge of their lives. And in this realm, you're the only one who's going to, who cares enough to really do it. And so learn, and then start educating other people, including your physician, as much as you can.
Yeah, absolutely. Well, I want to thank you again. I know you've been on my podcast a few times, and again, just lots of value, lots of really interesting stuff, and lots of things that people can do to improve the quality of their life. So I want to thank you again. This is Orest, the official old guy at oldguytalkstome.com. I just want to make sure that you subscribe, share, rate, and review, and go to thestandard.academy/magazine and get my free digital magazine. With one of the articles is one secret place to touch a woman. And it's not her clitoris, because that's not a secret place. So you have to find that out in the article. And remember, it's all about,
right?
What's that? Yeah. Remember, it's all about creating a kick-ass life for yourself and those that you love. Until next time.
Thank you for joining Dr. Orest and his incredible guest. Like what you heard and learned? Then be sure to do 3 things. 1, subscribe so you don't miss the next episode. 2, share this with someone who may need to hear it. 3, leave a review and rate this podcast. Opt in at www.thestandard.academy/magazine and get our free digital magazine with savings, articles, and deeper dives into cool controversy. Be the guy who takes action. Without action, you're not going to get the results you want. Thank you again, and make it a great day.